Hello, I'm Dr. Thompson, Akwo, Ntuba, international physician, political leader, an international communicator, subspecialized in global health communication and medical communication, or what is called MedCom. Global health updates. Global health updates. COVID-19. Global health updates. COVID-19. So far in the Americas, there is the present discussion and talk about boosters and vaccines for the pediatric age group or children. And the FDA is working with the pharmaceutical vaccine producers, Pfizer, Moderna, to look at the possibility of they having their vaccines for children out there between the ages of 5 and 11. And Dr. Anthony Fauci, the director of the Allergy and Infectious Diseases Institute at the National Institutes of Health in Bethesda, Maryland, USA, the medical advisor of the President of the United States, President Joe Biden, has been saying that maybe sometime at the end of November or getting to December, there will be definitive decisions about vaccinating children between the ages of 5 and 11. Our national vaccination strategies and plans are put in place so that the children are vaccinated immediately. The FDA gives the go-ahead or the approval. And many people believe that that will go a long way to bring about herd immunity in the United States and other Western nations. We are all aware of the fact that the Janssen or J&J vaccine has been given approval for boosters after their data that was submitted to the FDA. And it should be very clear about the booster issues. The boosters for the J&J is for everybody who has taken the first dose. After 2 months, is qualified for a second dose as a booster for the Johnson & Johnson vaccine. And it's also said that there can be a match. That is to say that if you took the first dose of the Johnson & Johnson vaccine, you can go ahead and get the Pfizer vaccine or the Moderna vaccine as your booster vaccine for the J&J vaccine group. That is 2 months after the first dose. For everybody who got the J&J vaccine or the Johnson & Johnson vaccine. That is quite different from the Moderna and Pfizer vaccine boosters. There, the cutoff is for people who are above 65 years of age and those with high risk conditions and also those who are predisposed to COVID-19, that is frontline healthcare workers. Those predisposed were also given the designation to include school teachers and people with pre-existing conditions who can go ahead and get the Pfizer vaccine after 6 months of getting the second dose. So those are booster doses. So you get that very, very clear. We make that distinction very clear. For those who got the Johnson & Johnson vaccine, or what they call the J&J vaccine, you can go in for a booster vaccine after 2 months of the first dose. And there's also the possibility of mixing and matching with the J&J vaccine, or mixing and matching the J&J vaccine or the Johnson vaccine with the Pfizer vaccine or the Moderna vaccine. So if you got a first dose of the J&J vaccine, you can go ahead and get your booster from Pfizer or Moderna. But the boosters for Pfizer and Moderna, for those who got Pfizer and Moderna after their second doses, the boosters are actually limited to people who are above 65 years of age. It's not for everybody. And then the particular group of high risk and those who are having pre-existing conditions. So I have made that distinction very clear because that is one of the major issues which are happening here in the United States. The other thing is hesitancy. And we are seeing this anti-vax movement and group of people who are out there, they are protesting and they are talking about their human rights and they don't want to take the vaccines, and it's their right, the claim not to have the vaccine and all of that. Good. They are fighting and working against mandates. The government and the authorities, the public health authorities at the state level and the federal level, at the CDC, the White House are looking into the issues. Some of the issues are playing out in the courts. And so rest assured that the country is taking care of all of that. Then as a global health approach to the problem, people are still being asked to respect the barrier methods, the public and social preventive measures that are put in place, especially in certain countries in the Americas and in Africa, where vaccination levels are still low and the incidence of new cases, hospitalization and deaths are still high. So there is need for people to still cooperate with their governments and public health authorities to make sure that the protective barriers, measures which have been used successfully, are still in place to help contain the virus, so that to an extent almost everybody can come out of the woods. We are looking at other related issues and looking at strengthening healthcare systems in certain continents and parts of the world. We know that the COVID-19 itself has expose inequality issues. We work extensively with the city of Houston in addressing COVID-19, the county of Harris, and I've traveled extensively to many states in the USA for COVID-19 work, and we brought back a lot of evidences and resources and inputs from Americans, people in the healthcare profession, and people out there. We talk with people out there and got feedback and input from a lot of people. Some of their input has been fed into our COVID-19 preparedness and response national programming support work, as they call that at the level of the World Health Organization. We are also making it clear that we are working with Dr. Larissa Etienne of PAHO, Dr. Mweti of the Regional WHO of Africa, and Dr. Tedros, the Director General of the World Health Organization. And we are having the meetings, the briefings, and we are feeding